Welcome, everyone. Thank you for being here. My name is DJ Wilson. I'm the host of our State of Reform conference series, and for those of you out in the hall, come on in. Really appreciate everyone's attendance and participation here today. We host these conferences. In fact, if you could go back to the PowerPoint slide, look at that bald spot there. Look at that. Gosh, there's nothing more humbling than looking at your overweight, pasty, bald self up on a very large TV screen. So again, we host these conferences, and the website and the email and all of the other things that we do as part of State of Reform because we think that there are not enough good, safe places to ask stupid questions, which are, it turns out, never stupid questions, right? The people in this room are some of the brightest, smartest, most strategic, most thoughtful leaders in Washington State healthcare. And we're just very proud to have you all here. But there are not that many places where you get the brokers in the room across the table from the hospitals, and the hospitals across the table from the legislators. And every community in which we host this is a little different. And in Spokane, we've made a point to reach out to students and to the schools here, specifically Eastern, Wazoo, and Gonzaga. And so we have made free tickets available to a number of students so that they could come and participate, so that they could learn and they could hear. And some of them will even challenge, which I think is exactly what we're trying to do. So in this year, our first event, we have over 250 registrants. That's great. I mean, I just am so thrilled. In our first CTAC conference, which we hosted, some of you have attended, we hosted our first Seattle CTAC conference in January of 2011. We had 300 registrants, and we were thrilled. We're thrilled. And now we have 600. So that Spokane has 250, I think, is a testament to how important this community thinks healthcare conversation is, and how important I think the topics in our program today are as considered by the community here. I mentioned the other places where we host this event. We host one now in Alaska, which is the largest healthcare event in Alaska. We host one in Oregon. And our CTAC conference is just, we can't put any more people in the room. We either have to move to Seattle or in this case, host something in Spokane. So we don't want to move the event to Seattle. We want to keep it in CTAC. And so we've hosted the Spokane conference this year in part because we want to create more opportunities that are outside of Seattle for people to have conversations about their local healthcare delivery system and improving that system. In addition to the healthcare conference, we also have a relatively well-attended website. I say relatively because we're very proud of the fact that we have 70,000 unique visitors that come to our website every year for news, analysis, event information, things that are not available in a lot of other situations. After Washington, Oregon, and Alaska, interestingly, the top states that hit our website are California and New York. The Wall Street Journal links to our site often, and we found that the Seattle Times and Puget Sound Business Journal and other sites actually pick up our content and run with it. We have 35,000 people now who subscribe to our email newsletter. You may be on the email newsletter. We send it out once a month called 5 Things We're Watching. It's specific to every market. We have one for Alaska, one for Oregon, one for Washington. You have a book here today. Dear Governor, if you had 5 minutes to talk health care reform with the governor of your state, what would you tell that person? The people who answer that question are collected in that book. So we fund all of that work just from sponsors and from people in this room. But we're going to start having actually even more work. We're going to start with freelance reporters in Juneau, Salem, and Olympia next year, specifically to cover health policy on the ground. And so to fund that work, we're starting a job board online. And we're starting an email subscription service where you can get analysis and on-the-ground information from each of the markets. So we're trying to take a very hyper-local approach using modern organizing, community organizing strategies and digital communication methodologies to bridge this gap between the mile-deep, inch-wide world of healthcare and the mile deep, inch wide world of healthcare and the mile wide, inch deep world of politics. Because those two God complexes don't like to hang out together very often. We get here today because we have a rock star convening panel who helped us be thoughtful about the agenda, helped us sort of identify some of the trap lines and pitfalls and make sure that we weren't stepping into the wrong stuff. Sometimes there is wrong stuff as you're trying to step through this. When we had last minute cancellations and changes to the agenda, our convening panel came through. And we have about 25 total folks from different organizations involved with us. And I really just couldn't be more proud of everybody who's participated with us. So if you're a convening panel member and you're here, can you stand up for a second so we can just give you a round of applause? Barb, good. Yeah, Donna, Jesus, thank you. I appreciate it, you guys. So the convening panel is, let me see here. So the convening panel is one of the primary things we need to do or need to have in order to have a successful event. We need four different cohorts. We need attendees, 250 I've already said is, I couldn't be more thrilled with 250. We need a great convening panel. We need speakers. We have about 60 speakers here today. It takes a little while to convince 60 people to give their time to come and participate. And we need sponsors to pay the bills. And I will tell you, INHS was the first call we made when we thought about coming over here. And I will blame Premera for giving us the idea to come over here because it was Len Soren that said, well, maybe we could just get 150 people in a room in Spokane, and that would be really, really valuable. So Premera gave us the idea. The first call we made was INHS because they have sponsored us on the west side. They've been engaged with us for a long time. And we said, if you think there's value, then we'll explore hosting this in Spokane. And if you don't think there's value, then we know if we can't get our friends to help us, then it probably doesn't make sense to do that. And we had tried to host, some of our friends had asked us to host something in Idaho, and we went to Idaho and we looked at it, and we built a convening panel, and we decided against it. So we're very keen on making sure that if you ask somebody their opinion, that you listen to it. And INHS said, yes, please, this would be great. So we would not be here literally if it weren't for INHS. Empire Health Foundation is another one. They had participated as a speaker, Anthony Chang, over in our CTAC event. We asked them to support this. They said, we don't support conferences. But DJ, your conference is not really a conference. Yours is a objective, nonpartisan, policy agnostic convening, and that's exactly the kind of stuff we want to support. So we're thrilled that those guys are with us. And our major sponsors, United Healthcare, Community Health Plan, Premera, Providence. Providence is another one that is engaged with us in almost every market. In fact, all markets that we do this. They're one of our best friends and really, I think, very thoughtful in their overall approach. Group Health, again, they're a wonderful ally of ours in CTAC and here. But I got to also tell you, Eastern Washington and Wazoo, we are very thrilled to have those guys both with us. As sponsors, we have a number of their students here for free to come. We don't have sponsors from academia in any of the 4 events or any of the other 3 events that we host, just here. And I think it's a demonstration of their commitment also to the importance of having this conversation. So we just couldn't be more excited. And I'll go back to this slide that was sort of inadvertently placed too early. But I just got to tell you, it's an honor for us to be here and to foster this conversation. I want to give you some logistical ground rules for the day, and then we'll have Tom and Susan come on up. Each of the breakout sessions today will last for about 45 minutes. When we open the doors, that means it's 45 minutes. So speakers should start to wrap up. You have 15 minutes between that door opening and the next session starting. Usually the sessions run a little bit long to 50 minutes or so, and that's fine. One thing we ask all speakers to do is to be respectful of, obviously, other people on the panel and the time allocation. But at 30 minutes into the panel presentation, turn it over to audience questions. You cannot have, this is not a one-way conversation. So people on the panel, we've asked them specifically to turn over the conversation to audience questions. So if somebody gets a little long-winded, sometimes with 60 speakers, there might be one, get that hand up as an audience member. Push them on it and say, hey, you're at minute 31 and I've got a question. Don't be shy. Because the speakers are ready for it and they're interested, I think, in many cases and maybe all cases, it's one of the primary areas of interest for them is that audience engagement. So with that, I want to have both Tom and Susan come on up, and I'll introduce both of them briefly and then turn it over to them. We have a jam-packed schedule today, and like I say, we're just honored and excited to be here. Tom Fritz is the CEO of Inland Northwest Health Services. They're all, you all know or know a lot about INHS, but you may not know everything that they do. So in addition to technology, they are also a provider. They also have air transport, about 1,100 jobs here in the Spokane area, and really pleased to have them on stage. Susan Johnson is one of our strongest behind-the-scenes advocates for us getting people together in rooms like this in each of the states in which we operate. She's the regional director for the U.S. Department of Health and Human Services and has a very interesting perspective on each of the states in which she operates, Washington, Oregon, Alaska, and Idaho, that we're honored to have with us on stage today. So with that, Tom, take her away.
Great. Thank you, DJ. Now, I do think that there is one variation in what you just said, because it was our understanding that Susan and I would be talking the whole time. So just so you know that. So we may not have any opportunity for questions of Susan, because we expect just to have more of a chat about what's going on from a larger picture point of view. But first of all, I do want to welcome all of you, and I'm really, really pleased. We've been a part, as DJ said, of this event in Alaska and Seattle for a number of years, and it's really been very, very fruitful to have these kinds of discussions. And obviously, for us in this region, healthcare is a significant part of the economy. It's a significant part of what we do, and it's very, very important. We had a great dinner last night with Susan and people from the governor's office and the state and others, Empire Health Foundation, and really had some very good discussion about a lot of the things that are happening and how monumental these changes are as we move forward here in the next few weeks. Again, I'd like to thank our co-sponsor, Empire Health Foundation. They work very closely with us. They have a seat on our board as well, a couple seats, and so we're real appreciative that they're here with us, and all the other sponsors that are here, really reflecting on the importance of it. And then just looking at all of you that are here, we have such a great representation across the state and the region of providers and plans and physicians, the military. We're really appreciative that you're all here. It's really an honor for me to be here with Susan, and one of the things that I hope that we've done over the years in working with all of our collaborators around the region is positioned ourselves collectively for success in dealing with the Accountable Care Act and moving forward in terms of how we do payment reform, especially in terms of the issues that we've done with all the technology and the data sharing, which is so important for all the transitions of care and all the transformational issues that you really need to have to improve patient care and reduce cost. So with that, I really would like to welcome Susan to Spokane. She's been a great friend and supporter for all of us around the region for a number of years. She's got a significant role working directly for Secretary Sebelius and represents our particular region that covers Washington, Idaho, Oregon, and Alaska. So she's got a very big job and has been in the thick of all of these things in terms of as we're moving forward. So we're essentially just going to have a dialogue, and hopefully it'll answer a number of questions. And as you all know, with the details of the presentations today, there's a lot of detail related to the exchange and other things that you'll be able to get into in other sessions, and we have great representation here of all parts of the system that you really be able to get to the detail of those particular issues. So Susan, perhaps we can just start. Last night we just chatted, and a number of people really talked about how historical and how profound this particular act is in terms of really the most significant thing probably since the creation of Medicare back in the 60s. Do you have a perspective about how important this is from an HHS perspective?
Sure. Thanks, Tom. And thanks, DJ, for hosting these events and for all of you for coming. It's great. It's always like a bit of a reunion with the Swallows coming back to these events. I see people, I haven't seen for several years, and our hair is a little different color. We look a little thinner or a little not, and it's just great to see everybody back. There's never a shortage of things to do in health reform. But to your question, Tom, as I was reflecting last evening, I think I've spent 30 years in health policy, and I watched us get to the precipice or the cusp of health reform in Washington 3 times anyway, depending on how you count the health reform, near misses. And it was just so exciting to know that this time there would be a chance to see actual implementation, to see the words on the page of a bill, of a law, actually touch people's lives. And in my travels, that's what keeps me going, and I know the Secretary as well, is you hear the stories of life-changing events because of the words on the thousands of pages of the Affordable Care Act, and that is monumental. I think there's no going back from this. It's like they say in Oregon with the coordinated care efforts there's no going back once you get to a new level of discussion. And I think we're there with health reform. We have to do things differently. Many of us don't like being told how to do things differently. There's a resistance to that in a federal law, but we weren't doing it. And what we had was not sustainable. So I think that we're in the area where we're in an evolution. And, maybe we're going to have wings that turn into flippers. Maybe we have flippers now that'll turn into feet. But it's a time of real evolution toward a better system, and it's very exciting.
Well, those of us that are providers, just the idea that people have coverage and we can get out of this whole issue of uncompensated care and transferring costs to private insurers and really having a very convoluted business model is very, very important from a provider point of view. And so also with the expansion of Medicaid, can you talk a little bit about how important that is in connection with the exchange and really addressing covering as many lives as possible in the region?
Sure. It's an interesting set of bookends, the states in my region. I've got Alaska and Idaho and Washington and Oregon. Washington and Oregon actively, energetically, creatively embracing both the marketplace and the Medicaid expansion, off and running from day one, before day one. Idaho and Alaska, a little more reserved. Idaho, the Governor Otter, taking great political risks to push through a state-based exchange marketplace for Idaho, watching carefully, weighing the pros and cons about Medicaid expansion. Alaska, not a fan of the bill at all, of the law, hanging back, federally facilitated marketplace in Alaska, likely not to go with Medicaid expansion right away, maybe over time. So the two going together is really important. So as we watch what evolves in Washington and Oregon, I think we'll see the best of what these two things bring together. And 1 and 1 will be 11. It's much more than just 1 and 1 is 2 in Washington and Oregon. Because of the Supreme Court decision, as you know, we've got an unintended consequence. The intention of the law was to make the Medicaid expansion required for all states. Supreme Court said can't do that, it has to be optional. So in places where states choose not to expand Medicaid, we unfortunately are going to have a new donut hole. And those folks who are potentially in most need of assistance will be left under 100% of poverty without a Medicaid expansion opportunity for themselves, and also not able to avail themselves of the tax credit. So that's unfortunate, it's difficult, it's something that hopefully will be corrected. I like to say personally, call 1-800-YOUR-GOVERNOR if you find yourselves in that donut hole, because they are the individuals who are making the decision to expand or not. But it's key to have really that huge umbrella, that universe of access for all open to the Medicaid expansion. I know the resistance also, particularly in Alaska, is, well, what happens after 3 years? We fall off the cliff and we have to pick up the cost. Well, We're going to all look to Oregon because I think they are on a path of sustainability. They're saying that it's not just the payment mechanisms, it's not just the expansion, but it's the delivery system savings that we've got to tackle. So the two go together. It's a wonderful pairing, and we'll have to see over time what the best models are that are available to all of us to emulate.
You know, you mentioned, Oregon, and they've been noted for really doing a lot of really creative things, and that's obviously one of the opportunities within the bill is for states and entities to really be creative in terms of changing the healthcare delivery system. Can you talk a little bit about what you see are exciting opportunities there that either us or Oregon in particular are doing that you see as fruitful impact that could actually have some national impact?
Yeah, I think Oregon is the beacon for me, and it's sort of like that old, I'll botch this a little bit, but whatever Rahm Emanuel said is don't let any crisis go unused or unutilized to the best. I think Oregon saw health reform as an opportunity to take it all on, to take the delivery system reform, to redo a health system in all its pieces, to have it fit the needs of Oregon. So the devolution from a state-based system down to communities, and yet to have a roll-up as they do in terms of outcomes from all those 15 coordinated care organizations to achieve a savings over time is really monumental. They're doing it. It's an investment that we, the federal government, have made. We gave them about $2 billion over 5 years to do this, to start this effort. But in return, they will return over 4 times that amount, or about 4 times that amount, in savings and in achieving outcomes that all those CCOs roll up to. So it's really the essence of what you want a system to be. You want it to be efficient, effective. You want it to drive costs down and outcomes up. And we'll all be watching very closely to see, what's not perfect, what needs to be tweaked, what is working, what are the best pieces that other states can follow. I think there's certainly an opportunity in Idaho to reform a system if they get to Medicaid expansion. They have a catastrophic county-based program, which is totally really the opposite of getting to prevention, which is where Oregon's going. It pays out money only when someone is in the most dire of circumstances. They know that's wrong, but it's going to be a huge political lift for them to switch all of those gears at once and to get from paying for catastrophe at the end to prevention at the front end. I think that's how we at the federal government see a lot of these pieces focusing. I know in the Affordable Care Act, we see incentives for prevention from no copays and deductibles for preventive services to incent people to go to get those services. And in a system way, we want to do that too. We want to have people in medical homes, not in the emergency room. And we want to deal with homeless people so it's not a difficult and odd situation where people have a medical home but no roof over their head. So we want to have a holistic view of health, and it's huge to do, but I think especially in Oregon and Washington too with the SIM grant, what will evolve in Washington with medical homes and the duals, there'll be pieces to watch and different puzzles to put together after some of these have a chance to live.
It's exciting for us to think about how we could redistribute some of the funds and pay for things that are really meaningful. Obviously, historically, our system's really been highly criticized because of the lack of transparency and significant variations in care and payment and cost. And recently, the Institute of Medicine issued another report that showed, the significant variations of the cost of reimbursement for Medicare in particular. And our region always ends up very well in terms of low cost compared to Boston or Washington, D.C., or Florida, Texas, other places like that. It's been an ongoing struggle for us with our congressional members trying to figure out how do you redistribute some of those dollars in regions like ours where they could be used more effectively, because we've obviously demonstrated certain things. While we still have variations in care here, and we're a member of the Puget Sound Health Alliance, and I sit on the Debris Collaborative, and clearly we've been analyzing significant variations even in places like King County where it's significant. I mean, and clearly we know that we have to narrow that gap and do the right thing and be able to move that money differently for other things like prevention. So how do you think the transparency, and do you think ultimately there'll be a way to level out those funds across the nation so that there'll be a redistribution naturally based upon the efficiencies or ACOs or different methodologies for how we get paid?
Yeah, that'll be a huge effort. And I think perhaps, again, incentives will come into play where we can take best practices and incent the kind of transparent behavior that drives to those goals. I always I'm an old fifth grade teacher, and I dislike sort of paying for not the best outcomes and letting people who, those straight A students, Washington, Oregon, and others who are doing well, not get more funding because other people are using it all. So I'd like to see how we can shift this by incenting the best behavior, shining a light on what is working, and then replicating that. Perhaps through the CMMI efforts, again, there will be efforts to expand what's really working, to drive the cost down, and to drive the outcomes up. But I think transparency is a huge role. I mean, we've just seen recently in Washington, and I know members of the Exchange Board are here, and it's been a trying couple of weeks to see how all these dynamics would go with plans allowed in through the dynamics of the review with the Office of the Insurance Commissioner and then the Exchange Board. And, at the end of the day, what do we have? We have what's best for consumers. We have more transparent procedures. We have reviews that have gone on at a level of intensity that we haven't seen before. And it seems to have come to the place where it should have, which is more robust offerings for consumers. So I like to think that we're going to see more stories like this where the transparency will show more choice for consumers and also will drive the costs down. That whole price spike, fear about what's going to happen, and the naysayers across the country, 300% increases. Well, we haven't seen that in Minnesota. We haven't seen it in New York. I don't think we're going to see it in Washington. I think we're going to see the opposite over time. There are going to be some blips and some bumps as things even out, but I think transparency is key, and kudos to the Puget Sound Health Alliance for, right in our own home area here, pursuing that.
We're really hopeful that stuff does really balance out in the long run and really benefit citizens in our particular region. You mentioned the consumers, and obviously I'm sure your office gets impacted a lot in terms of consumers asking a lot of questions. What's important to share with consumers right now as the exchange is opening up, and is there a message that we can share with consumers or do things that really promote consumerism? And as you know, a lot of people are somewhat skeptical, think consumers are going to make really bad choices and decisions, and this whole issue of responsibility is not something that some people like to give the responsibility to the consumer themselves for making appropriate, informed choices.
Mm-hmm. No, it's a huge dawning of a time for consumers who either have been kept out of the whole opportunity to have insurance. I think that's the most passionate piece for me. I think that, I hope all of us work toward having the stories on October 1st and November 1st and January 2nd be about, the woman who for 8 years because of breast cancer has been unable to be covered by insurance now has the peace of mind that she can have insurance. Or the family that has been unable to afford insurance, their employer doesn't offer it, now through tax credits, through the marketplace, can have that peace of mind and coverage through the marketplace. Those are the stories, not Susan Johnson had to wait 20 minutes to get through the call center. I mean, let's not diminish the moment. We should look toward the huge opportunity, as you've said, Tom, for people to come into a world of security and a sense of well-being and a future of health that they've been kept out of. I mean, this is a huge moment. I often think that this is probably as significant in terms of empowering individuals as was the Civil Rights Bill, because it shifts power. That's why it's been so toxic. It shifts choice. It empowers people, and it brings people into a world from which they've been excluded. So don't minimize the moment. And I hope that we maximize the stories of the importance of this moment. So I think that, yes, it's scary. Nobody likes change. I've talked to people who are going to put this off until the end of March because it's like a term paper. They don't want to do it. They don't like it. They're going to put it off. But we're going to do everything we can to help them not do that. We're going to have navigators and in-person assisters. You're going to see, as with the Washington Health Plan Finder, ads and bulletin boards and notices everywhere and TV and radio helping people to get them through that first door. It's extremely important, and I think that with the delay in the employer mandate, we'll have time to fix some of a lot of math that has to go on there, a lot of accountability. It can be simplified. We've recognized that. We've stepped back. I think we can make that better. But for individuals across the country and in our region, it is huge, and yet it's very scary. And because of the power of this law, again, every day I encounter stories where the fear mongers are out there. So here's a story. In Alaska, just 2 weeks ago, a woman in a situation very much like this kind of found me quietly at the end and wanted to talk to me privately. And she said, "So Susan, I know there's a federally facilitated marketplace in Alaska." She knew all this. And I said, "Yes, that's right." And she said, "But we've been told if we go through that, there's going to be an implant in our bodies, and the federal government will follow us everywhere." And I should have said, mine doesn't hurt at all. And but I said, of course, absolutely not. But I could tell she was terrified that she had believed this and was going to stay away from something she'd been told. So, we have to be watchful and careful to not underestimate fear that has been generated over 3 years about this coming event and work against it to help people find their way to really what is available now to them and for whom many have been excluded for years.
Well, it's interesting you mentioned the ads. Even in our paper this morning, there's a great ad on page 3 from Molina on the issue and encouraging consumers to connect with them. And, and we're excited about the exchange. I mean, I really think we got to give the state and the insurance commissioner a lot of credit in terms of, I think we're up to 46 plans now that are approved by the exchange and the insurance commissioner. How do we compare with in other regions, perhaps, and in terms of the number of plans and the offerings?
Yeah, I think you're right up there. There probably will be more. I don't remember the California numbers, bigger states with bigger numbers. But I've been very pleased with the numbers here in Washington and Oregon. Alaska, as we know, doesn't have that robust an offering. Idaho will be fine. But here's something I would throw out to the group, and this is where I am not an expert, but when I hear the word regional, what I go to right away is thinking, well, what could we do with that? I mean, there was the possibility early on for exchanges or marketplace to be regional, to be multi-state, and it was such a heavy lift for each state to get its own IT and everything arranged that wasn't grabbed onto initially. But I'm wondering over time, again in my sort of term of evolution, if, especially in our corner in the Northwest, there isn't a regionalization potential that could happen where some exchange sharing with Washington and Alaska could help both. I know we've got Premera going back and forth, but how can we help in Alaska become more robust? Is there a partnering we can do? Or similarly, thinking borders with Oregon and Washington. If Oregon is taking off, we know we have a bit of a small opportunity for the shop just on some bordering counties right now, but can we grow that? Is there a way that CCO idea could come over into Washington and we could pilot some regional, sub-regional efforts? Similarly, Washington and Idaho. So I'm just wondering if the time isn't ripe to think regionally. What can we gain from partnering with our neighboring states as things evolve? What could we put forth to CMS, to HHS, to pilot more of a regional effort that would help more robust offerings for consumers and for states to really take advantage of each other's strengths. That to me would be just a great win-win situation where we begin to partner in a regional sense.
Well, and that makes a lot of sense. You look at us in our community here, and, many people that come here for healthcare are not from Washington State. They're from western Montana, northern central Idaho, eastern Oregon, Canada. And so we serve a significantly large region. And for us running air ambulance, we do all that every day, flying in thousands of patients into this community for significant healthcare issues. So that makes a lot of sense when you think about it, because the other concern I think that providers have is if the states aren't on level playing fields, that patients will move to places where the benefits are better and yet there's no coverage, and then we're still in this trap of how do we cover the care, how do we provide the care, how do we deal with mandatory reporting that's part of the act and move forward. So it's a significant issue, I think, for us, Vancouver, other places like that in our state.
So I guess I'd turn it back to you then with what the examples you just mentioned. I think there's an openness and a flexibility also in this time with huge bureaucracies like HHS or CMS to invite thoughts about new offerings that we should make, like through CMMI. So when you think of the borders and the ambulance and the Montana people coming, can you think of avenues where you would say, wow, I would love it if CMS, HHS, and CMMI made an offering for a multi-state, whatever, fill in the blank description, and we would jump at it. What kind of thing would that, do you think, might be something that would be optimistic for you to look at in that regard?
Well, I think for us, clearly critically ill patients, a lot are sent to Spokane from around the region, and that's what we primarily transport. Specialty kinds of care that isn't available in other parts of the region, especially as you get out to more rural communities. Obviously, there's a lot of telemedicine. We still struggle with licensing and payment and those kinds of things for telemedicine. And we're connecting with Alaska and Montana and Idaho and all over the region every month. We've got hundreds and hundreds of contacts going on. So there's a lot of opportunity there. Clinical consultations, those kinds of things that could be offered to smaller communities in a way that today it's very difficult to work out any kind of payment methodology or business methodology to actually make it work.
Mm-hmm. Mm-hmm. The one thing I worry about in all of this is the focus on physical health and that we aren't up to capacity in mental health and that integration. And I know we're working on, that just made me think of that from what you were talking about, telemedicine, because I spend a lot of time in Alaska. And one of the pieces of innovation through the adversity in Alaska is the telemedicine, the huge usage of that. And they have found that unlike a moment of individual therapy or confessional kind of opportunities with a therapist in Alaska, because the villages are so small and the life is so intimate, there's such a reluctance to share those kinds of things that telemedicine is actually working very well in the behavioral health sense. And it made me think, well, maybe we should do more of it even in South King County, where we aren't yet on a preventive capacity situation with our RSNs. How do we get there? Because with Medicaid expansion, I think we're going to have such a huge number of people in need of both behavioral health and drug addiction needs that we are going to be overwhelmed. So what could we do to take advantage of things like telemedicine, and what offerings or incentives might be out there for us? Just a thought I was having as I listened to you, Tom.
Well, I appreciate you bringing up the mental health and substance abuse issue. We had a substantial discussion actually in Seattle yesterday with the state's effort to look at the plan, and obviously our needs assessment continually show that that's just a very, very poor part of our healthcare system, and I think we all see that's probably one of our worst social policies that we have, and that many people are in jail or prison that really didn't get the kind of care that they should get. Obviously, the ACA also builds upon mental health, and it has essential components of that. So a lot of people are very happy that it really creates the parity issue, and hopefully many more people will get access to behavioral health services. Can you talk a little bit about that from an HHS perspective?
Well, I think one of the remarkable things, again, about this moment is that for the first time, consumers, going back to that theme, will be able to shop by comparing the contents of plans that are the same. So those 10 essential health benefits have to be in all the plans, both in the marketplace and outside. And it's really the apple to an apple time that is really before us. Whereas before, it was hard to know what exactly you had, and then there was the difficulty of the caps that plugged in with lifetime or annual caps that you may not have even known were a part of your plan, all the rescission situations, all that stuff that went away in the first year and a half of the implementation of the Affordable Care Act. But now we have this, again, the theme of transparency, where comparisons of plans that have to offer maternity, have to offer preventive, have to offer ambulatory care, have to offer those 10 essential services can be compared again to how to pay for that within the construct of the plan that will fit your family. So I think that it's such a great time, again, of fairness and transparency for the consumer and for the plans to compete.
It's very exciting. You know, it's interesting from a transformative point of view, but there was a thing that came out just the other day that talked about Time Warner making an announcement that for all their retirees, they're going to move them into the exchanges. IBM has also said that, and some of the other large companies like GE have also said the same thing, that as this starts moving forward, which is something I don't think anyone ever really thought about in terms of how this might evolve. Have you guys thought about what the implications of that are? But it definitely is transformative when you see large companies like that with thousands and thousands of employees and retirees moving to the exchange.
Yeah, and I hope that as we watch what happens, that it's not something that gets termed dumping, but perhaps it's something that is wise shopping, that it makes sense for an employer to do this because the choices are more robust and the prices are lower. So makes sense, rather than dumping into some federal opportunity that seems wrong. So I think we'll have to see exactly what the numbers are, how it plays out, but I like to think that we'll have it as a half-full moment to say this shows the marketplaces are really competitive, are working, are making offerings that are really something that employers are looking to utilize more than we had anticipated.
So when you look at the total plans, have you been analyzing anything about critical mass or things of what we need to do to actually reduce the premium cost?
I'm not sure. I think a lot of that, again, in the competitive marketplace and the transparency, we'll see that plays out, again, with the large employers over time. I am hopeful that employers will rise to their best selves and not cut hours. I used to negotiate labor benefits for 15 years with SEIU, so it's nothing new that employers do this. But hopefully they will rise to the best of themselves and do it only for business reasons, not as some gotcha to an Affordable Care Act law that they don't like. That makes no sense, and it only injures their own employees. So I'm hopeful that over time the transparency will show up what is best, what is worse, and the employees will navigate that world to get to what is the best for them, as will employers, hopefully playing as their best selves.
DJ, are we out of time? Okay.
Yeah.
Well, Susan, is there anything else that you'd like to say to the audience? Any last comments or messages?
Just stamina. Hang in there. There will be more years to come after October 1st, so don't fall down on the finish line on October 2nd, and hopefully we'll all get to January and talk again in a year about how wonderful the year was. But thank you for all the incredible work you're doing at this wonderful moment in time.
Thank you, Susan. We appreciate you being here today. Thank you so much.
Thank you both. That was really great. Just as an aside, we don't give Susan any idea what the questions will be because we want it to be, really top of mind and sincere and thoughtful and not pre-scripted. there are very few people of her stature who would be willing to do that, right? Usually they have to have all of the questions up front. So thank you to you both, Tom and to Susan, for doing that.